Welcome to the very first episode of Safe Space Connects, where Filipino dentists learn and grow together. I'm your host, Dr. Chrissie of Safe Space. For our pilot episode, we invited two of the most respected voices in dental practice management. First, we have Dr. Leo De Castro, a seasoned dentist, mentor, and practice owner, known for his strong foundation in ethics, systems, and patient-centered care. He has helped many dentists understand that the clinic is not just a chair and a drill. It's a business that needs structure, leadership, and vision. And joining him is Dr. Ryan De Guzman, a modern dental business strategist who simplifies practice management, branding, and team building into clear, actionable steps for today's generation of dentists. He's been guiding many clinics to shift from survival mode to strategic, profitable, and sustainable growth. Doc Leo, Dr.
Hello.
Ryan, thank you so much for saying yes to Safe Space. Before we dive in, I'd love to start with this. For both of you, what are you most passionate about when it comes to dental practice management? Why does this topic matter so much to both of you? Dr. Leo?
What's passionate about business management?
Yes.
Well, it boils down to, of course, earning. Okay. The reason why we open up a clinic is because we want to open a business. Okay. It's not about practicing the profession, but it's all about earning and feeding somebody. Okay. So you need to know how to handle clinic as a business and not just as a professional.
That's very true. How about you, Dr. Ryan?
Okay, can I answer in Tagalog?
Yes, Doc, definitely.
Okay, anyways,
Kayang ng Tagalog.
thank you. I'm very passionate about practice management because for the past years, ang akala ko is for me to help my patient, kailangan magaling ako sa clinical. Pero after years go by, naintindihan ko, hindi lang pala dapat magaling yung kamay ko. Kailangan marunong ako sa numbers. Kailangan marunong ako bumasa ng tao. Kailangan marunong makinig. Kailangan magsalita. And all those are basically practice management eh. And at this point in time ngayon sa career ko, nakita ko na kapag tama yung practice management mo, mas mamaalagaan mo yung mga taong malapit sa clinic mo. Your patients, your team, and your family basically. No? Enough to produce, enough for them and give back sa community also as a whole. Kaya ngayon sobrang gusto kong aralin yung practice management, gawin siyang simple at maituro sa mas maraming mga dentist ng Pilipino.
So let's start with the basics, Doc. A lot of dentists feel tired or frustrated, but they don't always know why. From your experience, what is the number one mistake you see Filipino dentists making when it comes to running a practice? Ano yung usual nilang nakikitang nagiging problema pag nagpapatakbo sila ng management sa clinics nila?
Actually, a lot. No. Number one, why we feel tired. Usually, young dentists, they don't feel tired agad. Okay, because they don't have the sense of importance ng money as a whole. Okay. One of the biggest mistake, I would say, that most dentists, even I'm very guilty of this from the very beginning, is when you ask them, what's your break-even point?
Totoo.
And they were like, huh? Something like that. What's your break-even point for the month? Do you know? So, there are times wherein you have money. There are times wherein you don't have money. There are times wherein you have so much in your plate and you're doing a lot of things. And yet, at the end of the day, bakit wala akong pera? And dami kong ginawa. Because you didn't know what's your break-up point. Break-even point. Okay? So, that is something that you need to understand. Magkano ang kailangan kong kitain for the first 2 weeks for me to feel relaxed. Kasi once you reach that on the second week, pagdating ng third and fourth, kung ano yan eh. Kumbaga may bigas ka na, steak na lang ang pinoproblema mo.
Yung ulam na lang.
Ulam na lang. 'Di ba? Kaya mo mabuhay ng bigas ng unang kanin. Pero kung third and fourth, hindi ka pa rin sure, stressful yun. Especially when you have family. Especially when you're paying a car, a condominium, mga ganyan. You're paying tuition fee. Ibang level na yan. Of course, in the beginning, wala pa tayo niyan. Nakaasa kay mama at kay papa, di ba? So, hindi mo pa alam. Pero once naging independent ka na, that's when everything will start to fall into places. And if you don't know that basic, tapos.
Yung, Doc?
Well, to add up dun, break-even point, ilan ba yung kailangan kita para mabayaran sigurado yung kuryente, renta, and the sweldo.
Exactly.
Hanggat hindi malaman yun, is either excessive sa income or kulang sa income. So yun, malaking bagay if ano. But I think one of the biggest mistake na nagagawa ng mga dentists ngayon, it would be two. No? If you're a new dentist, sa tingin ko, yung isa sa pinakamatinding mistake is to open up agad yung sarili mong clinic. Because you just graduated, dami nating di alam. And yet, makukulong ka na sa clinic mo because you have to maintain that break-even point. You have to stay in your clinic, accommodate patients para mabayaran lahat ng financial obligations. And wala ka na opportunity to learn from very good mentors.
Yes.
Ako, dami-dami ko natutunan sa napakaraming mentors. There are mentors that will teach you how to earn 100,000, 500,000, 1 million, 2 million, 5 million, 10 million. And more importantly, yung makakapagturo sa'yo ng mentor na ano ba yung sapat. And number two, I think one of the biggest mistake of, mga nasa practice na already is ang akala nila, if they want to solve the problems in the clinic, they just have to buy two things. More CEs, more clinical proficiency seminars,
yes.
and to buy another latest best equipment. Akala nila yun ang makakasolve sa problem nila. But kung boils down naman, ang problema nila usually would be cash flow. Problema nila would be handling people. The problem nila is the branding of their clinic. Ang natatanggap nilang pasyente, yung mga hindi nila gusto. Yung pala, mali yung branding nila. Gusto nila high value dentistry, pero kung mag-advertise sila, low down payment. So, it'll be attracting. No? So, kaya yun, siguro mas maganda if yung mga dentist natin magkaroon ng a little bit more commitment in increasing their business acumen. Marami namang mapagtututunan yan. Lalo ngayon, sobrang accessible na information.
Yes. Yun ang nakikita natin sa young generations ngayon. How many years did it take you to run your own practice?
Do I have to say that?
Of course, please.
Well, I've been in practice for 30 years.
Okay.
I've been in practice. I'm a sole proprietor for, I would say, 10 years. And then the next 20 years, for the past 20 years, I've been in a group practice. That's when I've learned a lot about running a business. So all the things that I lecture about business management, lahat na nadaanan ko, lahat na experience. And then, sad to say, medyo late na nung natutunan ko. That's why I'm in PDA. I think one of the most sought after lecture on mine, even though I'm a specialist on implants, is practice management. Mas maraming beses akong naimbitahan ng practice management as compared to my specialty, which is dental implants. Yeah, kasi nga, number one, maraming dentistry graduate, if not all, I would say, walang business acumen when opening a clinic. Yung sinasabi ni Doc Ryan na you can earn 100, 500, 1 million, 2 million. Sometimes we earn that much money and yet at the end of the day, nasaan? Okay, some of us would say, my God, I earned 1 million for this month. Bakit kapos? Because there's another view on that side. Are you efficient? Pwedeng ang laki nung nagastos, binayad sa'yo. Pero at the end of the day, ang laki naman ng nagastos mo. So, ano yung net? Diba? So, may net profit, may gross profit.
Yes,
so, sometimes we see just the gross profit. Ang laki ng kinita ko, gross. But once you start computing, you realize the net is really, really low. Because there is some variable expenses, hindi naman lahat nga puro fix. And the one we're talking about, yung break-even point, that changes every month, depending on your variables. So, mas marami kang procedure, mas tumataas din yung break-even point mo because the variables goes higher. Okay, the fix is still there. It's fixed. Yeah, fix lang yan. But the variables, every time you do something, ang galing mo nga marami kang ng resto, my God, kung mag-ubos ka naman ng composite, ganun na lang. So, instead na efficient, hindi. You may be effective, but you're not efficient. Okay, so kailangan pagsabayan yan, effective and being efficient.
Dr. Ryan?
Question nga ulit natin.
How many years before you started your practice, or when did you start your practice?
I remember. Nag-employ muna ako. From Cavite, I used to go to Manila to serve as an associate dentist. And simultaneous to that, I applied as a school dentist in Cavite. And doon ko na-realize, dami palang bata. So, para ma-address ko lang yung problema ng mga bata, laking bagay na for me to earn, di ba? Yun naman ang mga batang dentista And then yun, after that, nag-aral na ng pediatric dentistry. Then, right after graduating from that program, I built my own practice. And then from that practice, doon ako nag-start na exclusive na pedya lang. Medyo nakakatakot kasi sobrang bawas yung magiging income mo, di ba? Just by doing pediatric dentistry. But from there, sa dire-diretso na po siya na nag-build ng practice. Hanggang sa ngayon po, I'm already 70 years into the practice.
Wow! So, both of you guys are really, kumbaga, yung practice nyo, nakita nyo na yung milestone nyo, nakita nyo na yung workflow nyo, nakita nyo ups and downs, nakita nyo na yung sabi nga nila, in the Philippines, we weren't taught that dentists should have golden hands. Inaalagaan daw ang kamay. Kasi ang ginagawa natin, bagong graduate, gagawin na natin lahat. Diba? Sabay-sabay. And then, at the same time, mag-aaral. Yun na nga, a lot of courses are being offered. And then, so my next question, the importance of management. So, yun na nga, many dentists are now investing in clinical courses like implants, ortho, aesthetics, but not in business management. Why should practice management be given equal importance as clinical skills? We know what we're doing na eh. We know how to do it. But what's the importance of doing practice management, especially for the benefit of those who would want to start their own practices in the near future? Doc?
At least in my opinion, I may be wrong. At least in my opinion, based on what I see and based on what I notice, that the dental curriculum lacks a in-depth practice management subject.
Yes.
We have practice management, but it's not enough. Unlike Resto, we have Resto 1, Resto 2, we have Prosto 1, Prosto 2, Prosto 3. But in practice management, I believe we only have 1 semester.
Yes.
Okay, and it's not enough. Eh, sabi nga nila, kaya nag-dentistry, hindi marunong sa numbers yan.
Totoo.
And then bibigyan mo ng 1 semester na practice
Magaling
management.
maningil.
Diba? So, magaling maningil, pero tama ba yung paniningil? 2, tama ba yung computation? May nagturo ba? I mean, the biggest question to all our audience, may nagturo ba sa inyo kung paano mag-compute ng clinical fees? Yes, alam mo mag-prep, alam mo yung depth, alam mo maglagay ng liner, whatever, and then alam mo mag-layering ng composite, alam mo maglagay ng mga characterization, but can you compute the cost generated in doing that, including the time spent plus depreciation of the clinic and all? So, paano mo nasabing tama yung siningil mo? Second, saan mo nakuha yung number? Kinopya mo sa kapitbahay, kinopya mo sa kaibigan mo, gano'n. How sure are you na tama siya o hindi? I'm guilty of that. Nagsimula ako sa kopya. Katawag ka lang sa mga kakilala mo, magkano ang singil mo? What if mali yung natanungan ko? 2, what if 2 gramong composite ang ginagastos ko sa kanya, isa lang. Eh di mas mataas ang cost ko. And yet, charge namin pareho. What if yung kuryente ko mas mataas versus sa kuryente niya? Eh di mas mataas yung cost ko dun sa kanya. That's why it's very important. I'm in favor of courses. Okay, I'm in favor. I mean, I'm very much in favor. I keep on telling my students that what you will learn here in dental school is the basic, it's the foundation. But that's not it. That's not what you need when you practice. Okay, that's enough for you to pass the board exam. But in real life situation, no. Kumbaga sa gera, nagpa-practice kang bumaril, eto bumabaril pabalik sa'yo. So kailangan umilag. So in dental school, hindi. One way yan. So that's why it's very important. I'm in favor of doing that. I want you to try as much as you can, but you concentrate on one at the end of the day. Kasi you can never be jack of all trades, master of none.
Definitely.
Diba? So you cannot do all different specialty, you're like a general specialist. No, cannot. You focus on one. But before you do that, doon ka muna sa practice management.
Dr. Ryan?
Well, practice management and the clinical side, no? Well, having proficiency in the clinical side will make your patients happy to go to your practice, no? But better practice management will determine kung gaano karami pa yung mapagsisilbihan mo and how many you can get on board to help serve as many patients as possible while deriving the best value possible. Kasi sa panahon ngayon, medyo nauuso yung marami nga pasyente, pero ang tanong, ang value nga po ba, kamusta ba? Is it still maintained or not already?
Effective ba?
Yeah.
So pwedeng efficient, pero hindi naman effective.
Diba? Yun. But don't get me wrong, we're 110 million plus Filipinos and kukunti lang dentista. Talagang volume ang labanan. Pero there's a standard in dentist na kailangan i-maintain. Siyempre, that would mean standards of wages, standards of the GMBs ng mga tao natin. Marami mga dentista, nakikita ko po sa forum, marami pala mga dental assistant, hindi nagsusweldo ng minimum. Wala pang benepisyo. Madedemanda tayong mga dentista niyan. Pag hindi natin alam yan, how would people stay with us in order for us to deliver value? Hindi lang naman po tayo yung tao sa clinic. Kaya kailangan magaling kayo sa clinical, focus on one particular strength of yours, and then you make sure na supported siya ng practice management. Para wala kang loophole. Not to mention all other legalities of what we're doing, no? Medyo maraming na-overlook tayo mga dentista, no? Na ako hanggang ngayon, inaaral ko pa rin dahil meron pa rin kulang sa ginagawa. And I hope mas maraming mga dentista medyo mas magkaroon ng affinity na gusto kong aralin to kasi alam ko medyo kulang pa yung kaalaman ko dito sa aspetong ito.
This is why I really wanted to be talking to you guys kasi not only that you are so grounded with what you do, so na-appreciate ko for you guys to be sharing it to the safe space community. So anyway, it's gonna be Christmas and New Year again. By 2026 we're starting, and for those who want to start practicing their own clinics or kung sino yung mga gustong mag-improve pa ng practice nila for this coming year 2026, tingin nyo po ba, Doc, saan sila dapat magsimula? Should it be the systems? Should it be the pricing, the leadership, or the patient experience? Saan nila? Sabi nyo nga, gusto nyo, or you're recommending dentists to focus on one thing. What would you like for them to, ano po yung gusto nyong isuggest?
Actually, 1 hour lecture yan. 2 hour lecture yan.
Nako, ang
well,
sarap.
in setting up a business, in my lecture, I say you have 3 M's. The management, the marketing, and the maintenance. That's 3M. Okay? So, before you open up a clinic, you have to make sure that you have a management system that is stable. Hindi lahat tayo pare-parehas. Pwedeng single proprietor, pwedeng group practice, pwedeng corporation, but you need to set it up, including the BIR.
Minsan, clueless sa mga
including
dentist
BIR, DNR, marami tayong dapat ayusin. Pag hindi nyo pa ito naayos, I strongly suggest that you start now. Business permit. Yung mga yan is something na parang hindi ganun ka-importante sa practice if you look at it. But in reality, nasisira ng practice mo someday. Pagka nakasuhan ka sa ganyang bagay, sarado yung clinic mo. Sayang yung pinundar mo. So you start first with the management. You sit down, you think, ano bang management ang gusto ko? Kaya ko ba ito mag-isa? Kailangan ko ba ng kapartner? Kailangan ko ba ng mas konkretong grupo by creating a corporation? And then second would be the marketing. How do you market yourself? In marketing, naging lecture na to bigla. In marketing, we have basically 4 P's: price,
Position.
the package, price, package, place. Okay, so may mga dapat mong intindihin yan. Okay, so first is the product. Ano yung produkto natin, service? Doon papasok yung iba't ibang specialty.
Yes.
Okay, hindi mo alam when you graduate kung saan ka magaling. That's one. That's not enough. What you've learned in school is not enough. So you need to know. Okay? So pag nalaman mo na yan, concentrate on that. That's your product. Okay? Next is the place. Make sure, okay naman yung place mo. Not necessarily high-tech. Okay? And then, how you package yourself. Okay, kailangan on time ka. Yung mga ganon. And then the price. You compute properly. Now that we're in, sabi mo nga, Christmas, time for you to sit down and recompute. Magkano ba ang costing ko sa isang month? At first, it's gonna be very hard. At first. But the moment you're done with 1 and 2 services ng computation, copy-paste lang yan. Like magkano ang anesthesia? Isang injection ang magkano ang gastos mo? Copy-paste na lang lahat ng gagamitan mo yan. Ilang gauze ang kailangan mo? Copy-paste na lang yan sa lahat. 30 minutes na clinical clinical procedure, magkano yan? Copy-paste na lang yan. At first, medyo mahirap. Okay? And then, yung third M would be the maintenance. Diyan na
Which
papasok.
we usually forget sometimes, right?
No, not maintenance in the health, but also maintenance yung ma-maintain mo yung
Existing
na setup mo.
practice. Oo.
Yung pera na kinita mo, paano mo siya ma-maintain? By investing. And at the same time, paano pag nag-retire yung mga staff mo? Say you have 4 staff. Nag-retire yan after 20 years. Ang sweldo niya nasa, sabihin na natin 25,000. 25,000. After 20 years, that 25,000 times 20, saan mo bubunutin yung perang yan? Retirement fee nila yan. By law, you're mandated to give.
Yes.
Paano kung dalawa bigla nag-retire at 20? Saan mo kukunin yung perang yan? So, dapat yun, as early as now, tinatabi mo na yan. Okay? Para pag umalis siya eto, katabi na yan. Then, wala kang kukunin dun sa tinago mo.
Totoo yun. Na-realize ko rin yun eh. I have one of my staff na 30 years old na. So 30 years counting I have to start now. And it's something that I will be very excited to give once na ripe na. I want to be that person na mag-withhold nito na alam ko pag natapos yung serbisyo mo because of your faithfulness to this cause, this clinic, I'll be happy to give it to you. Not because mandated by batas, but because it is my responsibility. Pero tama sabi ni Doc na gano'n, no? Na kailangan alam din talaga ng dentist na naglalaan doon. But ano ba yung pinaka pwedeng gawin since papasok na yung 2026? Sobrang broad kasi ng practice management eh. Ang hirap, where to start? And if it's too complicated, they'd rather not start at all.
Yes,
no?
actually.
Yun yung ano dun eh.
Yung sakana.
Oo, huwag na lang kasi ayaw magko-compete pa ako. Mag-excel po, mga ganun. Ang hirap niya eh. Pero it's something na madugo, pero I would say, yes, kailangan gawin. Kung paano kailangan maintain mo yung mga hand instrument mo is the same na sakripisyo kailangan mong gawin by putting on the numbers. Kasi you have to have the numbers. Because kung mayroon akong ma-recommend na pwede nilang gawin is, for 2026, start counting things. Yeah. Even if it's as simple as counting your gross income, just count it. Just making sure na documented yung expenses mo, yung mga fixed expenses, do it. If you can level up the variable expenses, sabi nito kanina, yun yung next step. Kasi kapag meron ka yan, mako-compare mo yung last month, next month, and mga susunod pa. Makakatulong yun para makapag-decide ka ng meron kang informed decision as an owner, whether should I invest in this or not, should I retract on this, gano'n. Sabi nito kanina rin is we should focus on efficiency. Hindi mo kailangan mag-expand ng clinic, hindi mo kailangan mag-hire ng bagong dentista, hindi mo kailangan mag-marketing. Ang kailangan mo, yung sabi ni Doc kanina, may maintain, may practice ka na. Just make sure that it's running efficient. Bawasan yung, kahit same yung perang pumasok, okay lang, pero bawasan mo yung lumalabas. Or at least alam mo kung ano yung lumalabas na pera. Doon pa lang malaking bagay na for 2026. Then pag alam mo na yan, you can concentrate on the next big thing na paano ko papalaguin if you like. But syempre, one thing also, I hope most dentists who would focus on the year 2026 is your staff. Okay? We will not be hiring AI or robots anytime soon sa service natin.
Thankfully.
No?
Yeah.
Thankfully. But problematic din also because pinakamahirap sa lahat is handling people.
Yes.
So for 2026, try to read some books on leadership, psychology. Kung anong masaya ka, sigurado masaya yung tao mo din dun eh. Try to work on things kung paano sila magiging masaya by serving with you in your dental clinics. Laking bagay na for next year.
Follow up dun sa kanya. Sinabi niya, you start computing.
Yes, sir.
May dalawang klaseng expenses yan. Capital expenditure at saka yung expenses natin. Yung capital expenditures, ito yung mga equipments and all. So you need to cost that. Magkano bili ko sa chair, magkano bili ko sa x-ray, magkano bili ko dun sa light cure, so on and so forth. And then you compute, gano'ng katagal ko ito gagamitin? 5 years. Kung ang isang bagay na 20,000 pesos, ginamit mo ng 5 years, and you use that 5 times a day for the next 6 days in a week, you compute. So magkano siya pumapata kada gamit? Okay? By doing that kind of computing, you'll realize na, etong equipment na to, hindi ko pa ito nagamit. So, yun yung white elephant. Then, magiging conscious ka ngayon kung ano yung, kasi pagdating lang na, PDA is around the corner.
Yes.
So, nandyan na naman yung mga, wow, ang ganda nun, bili
Mga
ako, wow.
shopping spree ng mga
bili ako
dentista.
niyan, ganyan. Pero pag marunong ka sa capital expenditure and how to cost it, ilang beses ko ito gagamitin sa isang taon? High-tech nga. Pero ilang beses ko siyang gagamitin sa isang taon? Eh kung hindi mo naman gagamitin sa isang taon, ba't ko bibili mo? And you'll realize that there's so many white elephants in the clinic. That's, occupying space.
Yeah.
Okay? And doon pa lang, makikita mo na, pag binenta ko, pera ko na to. Diba? Baka kaya dito napunta yung pera ko, kaya nawawala.
Yes.
Something like that. And I'm not earning from it.
Yeah.
Yun na nga. So, parang ang dentista, let's all be real. We have to make sure that with the suggestions of Doc Leo and Doc Ryan, we start with projection, right? Makikita natin in the next year, in the coming years, little by little, we'll be able to see the real
results, the
real results. So, okay. So, the next few questions would be about team and systems. Let's talk about something very real for every clinic owner, the team. With the staffing challenges today, how do you build a reliable dental team that stays, grows, like what you said, you had the associate na about 30 years na, Doc? And take care of the patients that you would want them to take care of?
Well, first and foremost, yeah, I agree with you. It's really a challenge. Number one, first is to find one. 2, to find the right one. 3, to maintain that right one. I mean, sometimes it's easy to find, pero maling tao. Okay, so you need to find the right one. And how do you maintain? First and foremost, these are people also. If you as an owner, You want growth. They want growth also. Ayaw naman nila na dyan lang sila for life, whether a dentist or ang pinaka-problema natin malaki dyan yung mga assistant, secretaries, yan. Kasi yung dentista, at one point in time, aalis yan. Hindi siya titigil sa tabi mo for the rest of your life unless alam niya na siya yung sasalo ng clinic mo someday. But if not, at one point in time, aalis yan at magtatayo yan sarili ng clinic. Yung mga associates ko, gusto nila maging Leo de Castro someday.
Yes.
Something like that. And I have a lot already na mas malaki, mas kilala pa sa akin, mas nagle-lecture pa sa akin. So how do you maintain, if you found the right person? It's by making sure that they feel na you're actually looking at their, future.
Yeah.
Okay. So nandiyan na nga yung maintenance. Okay. So sa akin sa office, every year, ini-invest ko yung 1 month salary nila sa investment. Okay? So, ako yung nag-i-invest for them. So, pag magre-retire sila, sabi ko, itong investment na ito ibibigay ko sa'yo at retirement. Okay? Pag may nangyari sa'yo, may insurance component yan. So, may matatanggap yung pamilya mo and all like that. Okay? So, by doing that, they feel na, binabantayan pala nung boss ko yung future ko, yung future ng pamilya ko, so on and so. And most of them, they stay because of that. Okay? And plus, you need to have a communication. You empower yourself as a dentist, diba? As a product. But you need to empower your staff also. Kung ano yung alam mo, dapat alam din ng staff mo. Why? Because they're the go-to person of our patient. Doon sila lumalapit. Doon sila nagtatanong.
Yes.
Pag hindi alam ng staff mo yung sasabihin, dahil magkaiba kayo ng takbo ng utak, then doon nagkakandalintik-lintik yung pasyente. Doon magda-doubt yung pasyente na hindi pala marunong tong doktor. Yung staff niya hindi alam something like that. So you need to, hindi lang ikaw. It must be as a team. Kung ano yung alam mo, yun din ang alam nila. Kung ano yung nangyayari sa clinic, dapat alam din nila. So on and so.
Correct. Staffing, right?
Yes, sir.
One of the biggest problem ngayon is staffing. I tend to see a lot of clinics that are expanding very, very fast. Ang dami. Kung may pinakamadaling gawin ngayon is to put up a clinic. You only need is capital. You just need capital, put it up. Buy everything that you need. But you cannot buy staff. No? Especially licensed dentists. No? So, ang problem na meron tayo ngayon is, it's not a problem that is also is nice thing because nowadays what is common is options. Before, pag naging dentista ka, konti lang option mo na papasukan eh.
Yes.
Either mamasukan ka sa kilalang dentista na ito, which is konting-konti lang, or you put up your own clinic. But now, ang daming option.
Yeah, super.
Kasama na rin yung option of putting up your own clinic that will surpass any other clinics na meron because you have parents na economically can help you out in establishing the practice. So, yun yung problema, no? So, how can we make sure that we have a team that will be with us to stay, no? Pero sabi nga ni Dr. Leo, at the end of the day, not everybody will be staying with you hanggang sa matapos ang career mo as a dentist because meron silang kanya-kanyang path. But, laging inuulit ko sa mga lectures ko, you have to have a clear mission and vision. Kumbaga sa jeepney driver, ikaw ang may-ari ng clinic, o yung driver, yung clinic mo yung jeep. Kailangan para may tamang taong sasakay sa jeep mo, dapat malinaw yung signage mo. Pupunta ka ba monumento, pupunta ka ng Bulacan. Kung malinaw yung signage mo, you get the right people on board. They will stay with you as long as possible, as long as papuntang monumento yung biyahe mo. They will step off, but no problem with that. Some people will join it ulit kasi nga malinaw kung saan ka pupunta. So, that being said, dapat malinaw yung mission mo so that you'll be able to get people for your clinic. Right now, we are around 5 branches, around 80 ang staff. We have around 30 plus dentists.
Such a huge
and they're just
number.
Sila yung nag-i-invite, not me. Because malinaw sa bawat nakasakay, saan ang punta? Doon, sa monumento. Malinaw. Kaya natadagan sila. And also, I have to make sure na meron akong systems that will support them growing. If they want to do the clinical stuff, I have to have the system for marketing para araw-araw may dadating na yun ang gustong ipagawa. May system ako na may dental assistant na kailangang tutulong sa kanila para maging efficient. May system also of collecting properly the payment and giving them the proper commission on a timely manner and a transparent manner. So systems are very important for you to put para mag-guide mo yung mga team mo para maging happy sila at the end of the day. Na they get to be compensated, they get to do what they like. If they enrolled in an implant course, you have to make sure as an owner that you market properly that you are an implant facility that can accommodate implant patients at sila gagawin nila. Ikaw, just make sure lang na may dumadating, masayang gumagawa lahat. Okay? You have to have that system para masaya yung team mo. Yung pagkakalam ko.
So, next question ko na yan was, it's all about systems. So, if you want to add, Doc Leo, just one system, what would that system be and why in your own practice? Should it be a system of proper scheduling, collections, case acceptance, reporting? Yun nga, sinabi ni Dr. Ryan kanina, if you had to have one system, ano yung gusto mong magkaroon?
Actually, kanyan eh.
Or matutunan nitong
It encompasses a lot of
viewers.
things eh. Hindi po pwedeng isa lang. Ako, sa akin, ako yung end result would be yung measuring result. Okay, so if meron kang system, and then mag-i-encompass na yan ng lahat ng mga kailangan. And that is, you measure result. You know, today is December 2025. December 2026, I must be able to put this number of implants, this number of crowns, this number of extraction, this number of whatever, you know. I put a number. Okay? Doon ngayon papasok yung, paano ma-achieve yan?
Hindi yan.
Okay? So that means, dapat tama yung scheduling. Dapat tama yung recall. Dapat efficient yung time. Kasi pag hindi mo ginawa yan, hindi mo ma-achieve yung mini-measure mo. Okay? And then, by December of 2026, you check, did I achieve yung measure na gusto ko? Pag-achieve, kulang. Achieve agad eh. Okay, I need to push a little bit more.
Yeah.
Pag mali, kinapos. Bakit? Saan ang problema? Bakit kinapos ka? Bakit hindi mo na-achieve tong, say, number of implants? Baka naman nag-grafting ka, sabay hindi mo naman na-recall for placement.
Yes.
Okay, so recall plays a big role. So, recall alone is a system, but that's not enough. Pwede mong na-recall pero hindi naman efficient yung timing mo. So, by making sure you have something to measure. Okay, yung meron kang goal, every December, etong goal natin. So, iba-break down mo yan. Let's say, for example, your goal is 100 implants or 120 implants. What does it mean? It means 10 implants a month. Okay? So, pag 8 pa lang ang nakikakabit mo and going to the 4th week ka na, kulang ka ng 2. Don't wait until December. Ayun lang naman yung goal mo eh. But there are times wherein, hindi talaga 6 lang eh. You have to make sure that March, habol ka, 12 yan. And then April, 12 ulit para makon mo. Okay? Kumbaga meron tayong break-even point na tinatawag. Now, kung achieve mo yan by September, October, mahina. Kulang.
Challenge pa.
Challenge pa yun. So, again, that's a system already. That's your goal. Okay? It's hard to pinpoint what system you need to do. But by doing that, lahat ng mga kailangan mong gawin, kailangan lumabas. Or else, hindi mo siya ma-achieve.
Actually, ganun din eh. If meron ka bang sistema i-establish for 2026, is making sure that you know their numbers. Diba? Alam mo, it could be the number of implants you place. Paano ko pwede alam mo kung implants, diba? So, what's my number? Is it the new patients? Recall patients? Diba? Basta you have the number because your practice should be growing at least 10% every year. Because your expenses are still also growing every year.
Correct.
Pag hindi ka na-grow ng 10%, you're not being relevant anymore. Maaaring bukas pa yung clinic mo, but who knows ano yung tinatanggal mo ng value na dapat natatanggap ng pasyente because you cannot keep up anymore because you do not know you are growing. Diba? You should always
Actually, that's a very good point. Yung increase.
Yes.
Okay. Madalas na tanong ko is, when was the last time you increased your clinical fees? A lot of our viewers would say, kailan ko ba huling in-increase?
How
Diba?
often do you think these clinics should do it?
Usually every year yan, you increase every year. Usually, okay? But to justify, some people say, every year, sobra naman yan. But to justify, number one, inflation rate happens, at 4 or 5% every year. So if you will not increase at least 4 or 5% every year, that means talo ka na ng inflation.
Yes.
Talo ka na kagad. So every year, that means yung supposed to be kinikita mo na babawasan ng 4 to 5% of inflation rate. Okay? So after 5 years, 25% na nawawala sa'yo. Di ba? Laki nun. Okay? 2, kano kadalas mag-increase ang gasolina?
For you to go to your clinic.
Di ba? Bakit sila linggo-linggo
Ang
nag-i-increase?
kuryente, ang tubig.
Ba't ikaw hindi? So, and sabihin, gasolina yun. Yeah, but ayun ang kailangan for the products to arrive in our office, for the staff to go to our office, for us to pay them. So, hindi mo nararamdaman yung mga produkto natin, yung binibili natin in order to do dentistry. Increases also. So, they have to. Or else sila naman yung talo. Okay? Businessman yan. Mas businessman yung mga yan kaysa sa atin. Okay? Do tayo yung kliyente nila. So, by not increasing, 10%. Actually, that's another system if you want. My goal is to increase 5 to 10% every year.
That's an ideal increase. Kasi,
Sometimes you have to play around. It's because there are parang bigas, petrolyo, and those things. Those are the sensitive fees that cannot be adjusted agad-agad. No? But there are non-critical fees, like if you charge rubber dam or radiograph, those are the fees that you can really try to move around, right? Yun. But sometimes, kung sa palagay mo in your clinic, hindi ka makapagtaas pa agad ang presyo. But remember, lahat tumataas nga kasi. Agaw ng paraan yan. So should you be more efficient in buying your supplies para you can get the discount? Para kahit hindi ka nagtaas ng singil, pero yung ginastos mo, kumonte. Pasok ka pa rin for this year. But hindi siya pang matagalang solusyon. Kailangan meron ka pa rin foresight for the next years to come. Yun.
Actually, going back dun sa sinasabi niyang efficiency. By study, yung binibili nating mga produkto, yung mga consumables, 30% of that goes to waste. Na-expire, hindi mali yung kulay, so on. That's 30%. Okay? So that means yung supposed to be kikitain mo na 30%, natatapon yan. But, if you're efficient enough to know anong shade ang madalas, anong hindi mo ginamit, paano mo masisiguradong yung wastage mo is sobrang baba, na hindi 30%? By cutting it to 20, that is an increase of 10%.
yes.
So that means your efficiency increases 10%. That means your income increases 10% without changing anything.
Basically.
Anything. It's there already. You
It's
just
there.
have to.
It's just, okay. Developing countries are basically inefficient. Okay? We're full of inefficiencies. Pilipinas, lahat ng mga
Third world.
third world. Okay? It's full of inefficiencies. But those inefficiencies is actually is a boost for us to earn more. That is kumbaga, ayan yung
Challenge.
ayan yung nakikita nating green light. Because by being efficient, kikita ka. Doon ngayon, yung efficient countries like the US, Europe, efficient na yan. So yung income o yung possibility of growth, konti na lang. Imagine yung inefficiencies natin of 30%. If you can cut it to 10%, that's 10% income. By making sure that you're 10% more efficient. 10% lang yan.
Even if it's a little number, it's
adds up.
going
That's up. If you're spending, let's say, $1 million in dental products, what's 10% of $1 million? That's 100,000. Isang magandang bag na yun.
Correct.
Isang, sa kanila, sa kabataan,
diba?
isang trip sa... diba?
Saan man?
Sobra-sobra pa sa Japan.
Isang Japan trip na yan. Okay. Next question. Again, about the staffing. Conflicts. Hindi mawawala ang conflict sa mga clinic. When there are performance issues or misunderstandings, how do you address them without damaging morale? Minsan kasi may boss na masakit magsalita, or nowadays we are quite sensitive, right? People nowadays are quite sensitive of what other people say. So how about telling us any tips as clinic owners that could help us address these conflicts? Yes, Doc. Mas marami ka palang staff. Paano mo na iisa-isa yan?
Well, one thing siguro is for you to avoid, conflicts will never be totally mawawala, no? But for you to be able to pass it properly, kailangan may standards. Kailangan may standards kung saan tayo nag-uusap. If nawala dun sa standard yung ginawa mo, then mag-uusap tayo. But one of the things na natutunan ko also is from the book na Ego is the Enemy by Ryan Holiday. Isang phrase na binanggit, the fish thinks from the head. So if there's something wrong na nangyari sa clinic, nagkamali yung staff mo, it will always boil down to the head. You as the owner. You will, before mo pagalitan yung tao, before nagagalit ako sa tao agad Ngayon, baliktad na. Pagka nagkamali, questioning ko, anong mali sa sistema ko? Bakit ba siya natusok? Bakit ba siya na-late? Bakit na-late yung pasyente? Bakit hindi na-appoint? All those problems is because I do not have a very efficient system.
Yes.
So the first time nangyari ito, I will check muna what really caused the problem. Medyo blunt ako sa pagtatanong dyan. Sinong may kasalanan? Yan. Bakit nagkaroon ng ganun? But walang bigat. Basta sino may kasalanan. Para we can take ownership bakit nagkamali yun. Then we try to solve it. Actually, sa States Doc, ganun din Yung OSHA.
Yeah,
diba?
OSHA.
If nagka-needle break ka, mapapagalitan, hindi empleyado. Yung yung the whole facility.
May booklet. OSHA booklet. We always read that. Para alam mo yung guidelines.
Sana ma-adapt natin sa Philippines.
Actually, alam mo, meron supposed to be tayong OSHA. I don't know, hindi lang nila in-implement. But meron tayo supposed to be.
It would be very nice kasi nga we are responsible for our people. So yun bali nga po. Conflicts, basta meron kang standards. In the clinic, I have an HR kasi ako I have a tendency of being malambot o magbigay para mapunta tayo dito. Ako, yun yung trabaho ko. Pero magre-reprimand sa na-late, mga bagay, trabaho na yan ni HR. Kasi may systems, meron tayong batas na dapat masunod na nakalagay doon sa handbook nila. So malaking bagay if may HR po yung dental clinic. Nowadays, ang maganda, may mga HR na that you can hire for a particular consulting fee lang, kumbaga. Mayroon lang subscription per month. You don't need to employ a full-time HR. Yan. Sa ngayon, pwede.
Well, conflicts. Marami kasing level ng conflicts The biggest issue is actually, or most of the clinics na nagkakagulo-gulo is conflicts among partners.
Yes.
Okay, sabi ko nga, pag nagsimula ng mag-compute ang isa, that's the beginning of the end of the partnership. Okay? So, paano mo mapiprevent one partner from computing? Bakit mas malaki kinita niya kaysa sa akin? Bakit mas maraming oras niya kaysa sa akin? Mga ganon. It's because hindi clear. Partner tayo. Tayo ng
It
clinic.
starts off with that, right?
Barkada.
Barkada.
Tara, tayo tayo ng clinic. Dito sa ganyan. Ganito, maganda yung clinic natin. Gantong kulay, ganyan. But they don't discuss anong guidelines. Paano yung computation? Anong daming oras ang kailangan mong ibigay dito versus yung ibibigay ko? Anong guidelines natin pag yung isang partner may isa pang clinic? Ayun yung mga conflicts. Now, if you do that before you open the clinic, ito ang usapan. eto ang hatian, eto mapupunta sa clinic, eto yung mapupunta sa'yo. Ganitong oras ang required na pumunta ka dito. So on and so forth. Meron, like for example, in our clinic, nung naging partner kami, lahat ng partners, sige, partner tayo on one condition, sarado lahat ng clinic. Kasi wala kang fallback position.
Yeah.
Okay? Kasi kung may fallback position ka, siyempre, pa nagkandalintik yung clinic mo, may clinic pa rin ako. And you always protect your personal interest, not the interest of the practice, of your group. But if you don't have any fallback position, kailangan mag-work to. Bakit? Kangkungan din ako pulutin. Pag naghiwalay-hiwalay kami. Something like that. So, again, sabi nga niya, you need to create the guidelines, you need to sit down and do the pencil pushing properly. And think of things, anong po pwedeng mangyari, paano natin to i-handle. Of course, you will not do it, 100%. Hindi mo magagawa.
Pwede po.
But, the first few years, few months of your practice, you always sit down and try to polish the guidelines. Okay. And, at one point in time, it will be like a well-oiled machine. It will just simply run on its own.
It's important for good communication with your partners.
Yes.
Especially dun sa formative years.
It's always nice to consult also legal and accounting.
Legal,
para
accounting,
well-covered lahat.
So, let's move to the patient side naman, Doc. End of the day, no patients, no practice. Right? For high-value treatments like implants, pedia, aligners, veneers, how can dentists increase the patient's trust? What really makes a patient say, sige doc, I'll go ahead with the treatment?
Okay, first and foremost, I mentioned this kanina, you need to empower yourself. You cannot offer something that you're not really good at. Because number one of the piece that I mentioned is the product. If you don't have a good product, at one point in time, it will fail. Okay? So, if inayos mo ng maayos yung produkto mo, just like when I mentioned kanina, I'm into, dentists doing, courses for them to understand. In the US, meron tinatawag na general practice residency. Wherein, before you take the postgraduate program, iikutan mo lahat ng specialty. May ortho, may endo, and so on and so forth. And then, mafe-feel mo on a postgraduate level yung production, yung procedure. And then, dun mo marirealize na, oy, endo pala ako. Oy, perio pala ako. And then you focus. Okay, now once you have that, then saka mo na lang siya isa sub-brand. You always start with general practice. Okay, general dentistry. You always start. Lahat na nagtayo ng clinic, nagsimula yan as a general practice, general dentistry. But you start creating a sub-brand. Okay? Sub-brand mo, like for example, my sub-brand is implants. Sub-brand of my partner is perio. Okay, so meron kami endo. So, yun yung sub-branding namin. So, how do we maintain our patient? By making sure na, number one, alam mo yung ginagawa mo. Two, you have to explain properly without hard sell. Me, every time there is a missing tooth, I give them options. Not just implants. But of course, the patient would feel I'm pushing for implants. But I give them options. And so that you empower the patient to decide. Pag nag-decision sila, talaga namang they trust you.
Correct.
A lot of dentists kasi feel awkward about the money part, right, in practicing. Paano nyo, Doc, nako-communicate yung fees confidently without feeling nahihiya or being salesy? Kasi honestly, hindi tayo salesperson eh. 'Di ba? How would you encourage the dentist on how to do that? You, Doc?
Okay. Well, sa amin kasi we're just doing basic dentistry, no, for children. But if it's crumpled up para magawa in a sedation procedure, that's when it becomes very complicated, no? Parang high value dentistry na siya nangyayari. Now, how do you make your treatment plans sound confident, no? Well, you have to have 2 C's. Number 1 is certainty.
That's what I liked in your, I heard in your lecture, the 2 C's. Explain.
The first C is your certainty. Now, the good thing right now is when you get to listen from the lectures of Dr. Leo and other lectures by the PDA, evidence-based lahat. So, ibig sabihin, the certainty of you getting that particular outcome is this much percentage. So, if you as a dentist, nakafocus ka in evidence-based dentistry, then yung certainty ng delivery mo ng procedure na yun, mas mataas. That will add up to the conviction, the susunod na letter C. When you talk, there's conviction. Wala nang fancy kung ano-ano, but there's that particular confidence and conviction on how you say things. When I'm going to do implants, the price is this one. Okay? You're just stating the fact that this is a price. When you talk, kailangan hindi pagdudulo. Ang presyo po is 150,000, hindi pa taas. Dapat the price is 150,000. Malaking bagay ang pababa. Those things. So, again, mag-aral, siguro din yung mga systems mo will support all that certainty of the outcome that you hope for your patient, and the confidence and the conviction will come, the 2 C's. So, you'll be able to close better. Ngayon, what I do is I train my staff to do it, and then what they do, they're the ones that talk to the patient and convince them that their children needs to undergo procedure or a rehab under sedation. Nako-close na raw on their level. Then papasok na ako nun kapag gagawin na yung procedure under sedation, because kami lang pwede gumawa eh. But I train my staff to do those things of closing para, and even yun binibilang, yung conversion rate na tinatawag.
Yes.
For every 10, ilan yun ako convert. When I was practicing talagang ako lang, my conversion rate was 70-30. For every 10, sa 7 yung nako-convert ko. Yung mga staff ko, pag bago, ang conversion nila baliktad, 30-70. Kapag ikaw, wala kang tiwala sa staff mo, dahil wala kang kabisado yung sistema mo, yung 30-70, ayaw mo yun. So, kukunin mo yung pasyente, may-ari eh. Ako na lang gagawa kasi mas mataas closing ko eh. But if you know how to train, you have the system, you know have the numbers, you can trust that person, that associate dentist of yours, that yung kanyang conversion rate will grow and grow. Baka ma-surpass ka pa niyan. But you have to know the numbers, you have to know the system para mag-guide mo sila going doon. Hanggang di mo alam yun, mangyayari. Nakikita ko nga sa mga forum eh. Shout out sa dentist na kapag ito yung case nangunguha. Ganyan. So yung mga hugot ng mga associate. Meron kasing forum ng dentista eh.
Buti na lang hindi ako active social media.
Nababasa ko kasi sila. Sabi nagagalit doon sa may-ari na dentista. Yung may-ari ng dental clinic namin, kapag implant yung case, kinukuha sa akin. Pag mataas yung mga kinukuha sa akin. That's not empowering, right? How could you maintain a staff kung gano'n ang gagawin? But anyways, you have to know how to teach your staff or yourself to be certain and to have conviction and confidence.
Picking up in what you're saying about yung dentist who's not really into sales. Okay, how do you handle it? Yung sa kanya pwede yun kasi may conviction pagdating sa when you sell. Okay? But how about a lot of dentists na may hiya. Lahat yan. What we normally do, especially high-value procedures, it's not something na, you say, it's 150,000. Times 4. Or 150,000 times 8. Di manlulula agad yung pasyente, di ba? So, it's kind of hard to tell the patient na ito yung cost niya, 1.2 million. Or something like that. So, what we do, we give a treatment plan. Okay, so we'll check everything and we'll discuss ano yung mga procedure na po pwedeng gawin. We'll give them options, so on and so forth. And then, we tell them, sabi niya, Doc, magkano? Ganun yan eh. At the end of the discussion, Doc, magkano? We'll prepare the treatment plan. We'll give you the time, and then we'll give you the cost. Okay, well, again, high-value procedures doesn't happen in a click of a finger. So it means it will take some time for you to finish it. So it's not something, it's a 1.2 million, it's not something that the patient will cap up, 1 million and the 200,000 will be, 2 weeks and 3 weeks from now. No. It will take some time. So what we do, we give them treatment plan. Ito yung gagawin mo. You know, let's say, scaling phase, and then eradication phase, you know, extraction, so on and so forth. And then nilalagay mo yung different costs, and then yung time intervals, and then you ask them conforme. Yun, malinaw. Kita nila, may kopya sila. So that during the procedure, let's say a 1-year procedure, alam na nila kung nasaan na sila. At alam na nila kung ano yung costing na ilalabas nila on a certain time.
Yeah.
For those who cannot, you know, upfront say this is the cost, you do that.
And that's one system actually, the treatment plan. Actually, Doc, isa sa na-observe ko, of all the specialities po, yung mga magagaling ng mga dentista, napupuna ko, no, lahat sila may treatment plan. Kaya nung nag-aaral nga po sa pedia, yun naturo din sa amin, you create a treatment plan. Yes. And that treatment plan, meron kang good, better, tsaka best option. Tandalo yung presyo, ganun. Walang convincing. You just did your diagnosis, here's the treatment plan, then you can discuss
You can discuss the different options, option 1, option 2, option 3. So that the patient would know, oh, this is the option 1.
Benefit,
and then you give them the cost. You give them the timeline. You know, sometimes, you know, option 1 is cheaper and faster, while option 2 is more expensive but will take longer time. But of course, longer din yung life ng procedure, so on and so forth.
So it helps, really helps the dentist, the patient to plan.
Nowadays, it's quite nice to see dentists to do treatment plans. Before, the traditional way was just putting it, writing in index card. Yun yung and the good thing about that is the case acceptance would be much higher. It's how we can improve the conversion, no? How would you react, or how would you show to the patient na hindi sila masyadong mape-pressure about you give it timelines, right? Like what you said, Doc, or options, and what else could you add in guiding the dentist to make the patient accept the treatment?
Let's say for example, the patient needs an implant. Okay, I don't pressure them na kailangan mo ng implants. I usually tell them, first things first. You need to remove the causative factor, the infection, so on and so forth. We extract. We do the perio procedure first, and then you decide. Okay, kumbaga, let's focus first on the chip complaint. Okay, you're not jumping your guns na implants yan. But before you do implants, magpe-perio ka muna, magre-resto ka po muna ng ibang ipin, and then mag-exo ka pa, may possibility ng grafting. It's not just directly towards the implants right away. By jumping your guns towards the implants, medyo alam nung pasyente na, oy,
CLC.
Benta agad ang gusto nito. But especially,
feel nila
especially diba? If you have different options. And then the patient would say, honestly, Doc, I don't know which option I want to go to. Okay, I want this, but it's a little expensive. And I know it's going to be little, and then it's lengthy. And it's like, you have time to decide. First things first, we handle the chip complaint, and that is your swelling, your pain, so on and so forth. And then from that point, magkakaroon ng confidence sa'yo, yung pasyente. And then you'll be surprised, ang taas ng acceptance rate. Also, in our office, walang pumupunta pag-consult ng implants na hindi ready mag-implants.
They already know what they want.
Yeah. So, yun. So, the fact that you're here, gusto mo, yung bibigay ko. Something like that. So, ang tanong na lang dyan is, may bibigay ko ba sa'yo magugustuhan paano ko i-present sa'yo. Yun na lang ang issue dyan. So, dapat doon confident ka na. Na the reason why pumunta yan, like, for example, a patient who went to your clinic, wag nang high value, a patient who went to your clinic for cleaning. They want cleaning. So, you need to be confident na kaya nakakaupo yan dito kasi gusto niya ng clinic. So, why do I need to hard sell? Diba? Something like that. Or may feeling, gusto niya nagkaroon ng laminates, something like that. Gusto niya ng whitening. Alam na nila yan. Unlike before, hindi nila alam ang presyo, walang internet, nothing like that. Now, they know more than us, the patient.
Actually, that's very true.
So, and alam nila yung presyo ng kapitbahay natin, tayo hindi natin alam. To that point. So, that's why, pag pumunta ng upuan mo yan, you should be confident enough na kaya nandito yan kasi sa akin. Something like that.
How about for you? Because you have also to talk to the parents as well, di ba?
Yeah.
It's not the patient.
Well, at the end of the day, you just
themselves.
have to focus on the chief complaint Diba? Address
Yun muna.
Just like going to the mall, meron kong kailangan biling sapatos, pumunta ka dun sa sales lady, yung kailangan mo itong sapatos, pero yung sales lady meron siyang kotang hinahabol. Dinadala ko dun sa kailangan niyang ibenta. Di ba naiirita ka nun, di ba? So, it will lead you hindi ka na nasatisfied, hindi mo nahanap yung nahanap mo, tapos galit ka na dun sa nag-o-offer sa'yo. It's the same with dentistry. Focus with the chief complaint.
I think even the, di ba, in pedya, I mean, kasi I do odontectomies and I talk to
The parents.
Okay? The parents know kung sino ka. The parents know na kailangan gawin.
They already...
So you don't have to hard sell. You just have to tell them what needs to be done, how it will be done, and how long will it take. Something like that. And then usually the cost, kung na lang yan nagbabaka sakali na lang magkaroon ng discount. Yun ang baka sakali na lang yan Pero yun naman kung nararamdaman nila na hindi ka confident. Pero pag confident ka, hindi hingi ng discount.
Pero connecting dyan would be the branding and the reputation Sabi ni Doc, the moment he gets to see a patient, hindi na kailangan hard sell. Kasi the reputation ni doctor mismo, yun nagdala for the patient to be sitting there in front. Wala hindi naman pumunta kasi ikaw yung mura or something like. Yung reputation na build mo for yourself. Kaya hindi mo na kailangan masyadong mag-hard sell. That's why you...
Though I think sa mga new dentists, hindi pa siya.
Ibang usapan.
Ibang usapan pa yan. So, but then again, if you imbibe what we're saying na kaya pumunta yan dyan, magkaroon ka ng konting confidence. Kasi like in our level, in our field, hindi naman pupunta sa office ngayon kung hindi nila gusto magpa-implants yan. So I don't need to, 7 out of 10 na pumunta makipag-usap. Usually yan, almost 10 over 10 yan Pag may pumasok yan, guaranteed na yan. Ang tanong na lang dyan, ilang implants ilalagay. Okay, anong procedure gagawin ko? Is it an overdenture? Is it a full fixed bridges? Kaya ba niya ng 4 o kailangan 8? Something like that. Yun na lang ang discussion dyan Or pasasama ba niya yung ibang bridge dun sa kabila, so on and so forth. But on a particular area, yun. So for the newbies,
for the newbies, yes, please.
For the newbies, it's important that you start imbibing yung confidence level. Okay? You need, again, we go back to yung mga una namin nabanggit, you need to empower yourself. It's quite hard to sell something that you don't know what you're selling. That's impossible. If you yourself are not confident with what you're selling, then the patient would feel it. I'll give you an idea. When I was in NYU, siyempre, implants ako, meron akong barkada na prosto. Same school, same postgrad. Nag-i-implants din siya. Siyempre, kasi part ng curriculum nila. Pag uwi namin, may dala rin siyang implants and all. After 5 years, tawag sa akin, sabi niya, pare, can you buy my implants?
He wasn't
hindi ko pa
able
nagagamit.
Okay.
And yet, specialista siya. Why? Because ang inclination niya is more on fixed bridges, RPDs, and complete. So, nai-imbibe ng pasyente na ayun ang inclination nung dentista ko. Kaya yun yung ikukan nila. Kasi doon siya empowered. Doon nag-aral sila ng implants, but not as deep as us. Something like that. So again, doon pupunta yung postgrad. Or
it's still a very important matter.
Yeah.
For the newbies, diba? Basta establish your branding, ano ba yung inclination mo? That's your branding. But you have to lay it brick by brick. And then eventually, meron ka ng reputation. Parang mas madali sa'yo to close cases.
So let's go to a bit of brave and talk about money and growth.
Mm.
For sometimes clinics end up na nagiging stagnant. So for those clinics na they feel stuck, same income, same number of patient, what is usually the missing piece, do you think?
Innovation. I mean, you need to innovate. Sometimes we are so accustomed to what we're doing day in and day out that we realize na na-stuck na pala tayo with day in, day out, day in, day out. These are the mga dentists who do not go out and learn more. Diba? So, in dentistry, diba, lilac? Live it like a calling. Kaya lilac. Okay, so it's a calling for you to push hard. There's a goal. Go on learning dentistry. So you continuously learn dentistry. Pag hindi ka na natuto, hindi ka na nag-iisip, o hindi ka na lumalabas para matuto, you open your mind, mag-stagnate yan. Ako, up to now, every single year, I still do my training. Despite the fact that I teach, I train. But I need training myself. So every year yan, walang mintis yan. I go out. I forget about the clinic. I return as a student. And as a, and I train. New stuff. There are times that I can, practice it in the office. There are times that will not work in the Philippines. Something like that. But hindi nag-stagnate yung utak.
Correct.
You doc?
Well, it starts with awareness again. If you do not know na, sabi mo na, they're dentists na they feel stuck. Something subjective. Parang feeling ko parang wala nangyayari. Siguro nga, wala kasing awareness on the objective things. Ano ba kailangan mong ipuntahan, di ba? Should you increase your income or should you decrease your expense? Or should you remove something sa ginagawa mong dentistry? Like what I did several years back. I stopped doing adult dentistry. I focused on pediatric dentistry. Who would have thought na yung pag-subtract ko na yun pala yung mag-a-add or mag-multiply kung nasaan yung position ko ngayon. Sometimes, minsan, baka yun na yung pinakakailangan.
Actually, this is a good break. Creating something like this. Me teaching is a good break. Wag na yung golf, wag na yon. But something to do with dentistry. Lecturing, that's a break. And every time I lecture, I learn from the things they ask me. Natatouch base tuloy ako kung ano yung mga gusto nila. And yun yung naiisip nila because of the questions they ask me. Then, doon na re-restart yung takbo ng utak mo. But if you go to work, go to your clinic Monday to Saturday, yung break mo is shopping, something like that. At one point in time, stagnate ganun na lang ng ganun yun.
Yes, yung cycle.
Yeah. But if you have, kumbaga meron kang yung tawag yung meron kang hinahabol pa. Diba? Meron ka pang meaning in life. Purpose-driven. Parang gano'n. So nakikita mo na yung purpose mo. Purpose ko is to share. Purpose ko is to serve. Something like that. Then, kita mo, hindi mo kang mag-stagnate.
The thing that I find with the lecturers like you or speakers, that you guys have that mantra, teachable spirits. Kasi even though you've been in practice for so long, you still want to learn. That's what I really admire you guys. So now, financial habits naman, Doc. What could you teach every Filipino dentist about? Siguro mga 3 financial habits. What would they be in terms of cash flow monitoring, understanding overhead, pricing properly? Natanong na natin yan kanina pero would you want to add more about it? About what are your financial habits that you want us other dentists to adapt?
Just like what I mentioned kanina, you need to understand finances. It's not something that you will learn through the years, no. You need to sit down and understand. you need to force yourself to understand finances. It's not a sari-sari store na bumili ka ng 50 cents na bagay, bebenta mo ng piso, kita ka ng 50. Something like that. No, it's not. Kasi maraming variables na that. So you have to, number one, you have to understand. Okay? Two, yung pera na kinita mo, you need to invest. Okay? To share with you, one of my biggest, kumbaga, ito yung hanggang sa mag-retire na ako, ito yung sabihin ko. Sana hindi ko ginawa. Okay? I invested money sa stocks. Okay? Sa mutual funds. After mga 5 years, 6 years, ang ganda na ng kinita niya. And I was like 20. Kung lang yun, kumbaga, at random lang. In-offer sa akin, nag-invest ako after 5, 10 years. Ang ganda na nung return. Sobrang ganda na. And I was like 30 years old. Right? So, siyempre, eager na makisabay ka ng mga gastos and all. Winidraw ko. At ginastos ko. Now, looking back, my God, kung hindi ko tinanggal yun.
The compound effect of it.
Kung hindi ko... I'll probably not practicing anymore. I'll just be lecturing. Something like that. And it was just that. Now, I cannot turn back the clock anymore. So for those who are still 30, 35, 40, you have another 30 years. So by the time you reach 70, my God, you're financially stable by doing it now. Now for those who are 60, medyo kapos ang oras. So yung mga may mas may edad sa akin, kapos na kayo oras nyo. Tapos nalipas na kayo. So if you want, this is the right time.
You, Doc.
Ano bang habit? Well, understanding na ang binayad sa'yo ng pasyente ay hindi mo pera. Sa kada binabayad ng pasyente, sabi ko, usually, ang sumasweldo sa clinic, di ba, 3. Ang sumasweldo, number 1, is yung dentista. Susunod sa sweldo is yung mga staff mo. Pangatlong sumasweldo, yung pera mo. And you have to know where to put that money.
Cost of money.
Yeah.
Yes.
Hindi palibasa, pera na yan, gagasusin mo. You have to save yung pera na yun, di ba? And when you save, hindi yung pwedeng basta lang ilalagay lang kung saan-saan. Because everything compounds, di ba?
1 hour lecture.
Mahabang lecture.
Sarap nang makipag-usap eh.
Mahabang
Pwede ba
lecture.
humaba
But
to?
well, at least being aware lang na 3 yung pagpupunta ng pera ng pasyente, malaking bagay na yun. At least may awareness ka nga ulit. Tapos malaking bagay na siguro di mong meron kang 1/3 for the dentist, 1/3 for the staff, and the patient, kasi mag-invest ka rin parang ma-enjoy nila. And 1/3 for that's their money earning.
Perfect computation. Kasi based on the study, the professional fee is usually 30% of the clinical fees.
Yes.
Usually. Okay. Ayun yung average. So, anong ibig sabihin nito? So, if I earn 10,000 pesos today, that means when I go home, I'll bring 3. The rest of the 7 stays in the clinic. It's not yours. It's the clinic's money. Okay, that's the shortest of all the discussion. At the end of the day, the gross amount, you deduct 30%, that is yours. That is yours to invest, that is yours to spend,
Up to
that
you.
is yours.
Up to you.
Yes.
The rest of the 70% is not yours. It's your business money. Okay, and if you do that, I guarantee
You'll go a long, long
Yeah.
way. Okay. So, a lot of dentists dream of opening second branches and additional branches or hiring more people. When do you think is the right time to expand? And are there certain numbers or signs that the dentist should look first before opening another branch or expanding? Doc?
iba-ibang concept yan. Technically speaking, your branch is enough to handle your patient. technically speaking, your patient. Okay. So you can do things by not opening a second branch, technically speaking. But when people coming from other areas to your office, pag ganun na. Say for example, why did I open Alabang Clinic? Because I have lots of patients coming from Alabang. When then they start complaining na, Doc, wala ka bang clinic sa Alabang? That is a signal for me that I need to open a clinic in Alabang. But kung tatlo lang naman ang nagsasabi nun, and hindi ko pa kailangan mag-open. So if those numbers is enough, again, break-even point. If those numbers, those people who is clamoring for you to open up a branch in Alabang is enough
to hit that break-even point,
I'll open. Then I know I'm not pressured. The rest of the newcomers would be, sabi nga nila, bigas, ulam na yon. Hindi ako magugutom. Okay, ngayon, if you open a branch, wherein, wala kang kilala, wala kang pasyente, ayun, you start fresh. You start brand new. You really need to work hard. You need to be there. Paano itong kabilang clinic? Something like that. That's my point of view. Sa kanya, mas maraming clinic.
Oo nga.
Siguro, I think the question is not when eh. The first question would be why.
Yeah.
Because sa panahon ngayon, sometimes we just want to open up a branch because we want to appear that the persona that is a successful person, maraming branches na binubuksan. But ano ba pinakadahilan muna nga? Kailangan ba talaga magbukas? Kasi minsan, yung peace tsaka yung happiness ng isang dentista is, ang bottom line, mas maganda, isa na lang binabantay mong klinik eh.
Totoo.
Not marami. Akala nila, may isang branch ka, maganda yung kita. Pag nagbukas ka ng isa pa, times 2 na. No. Hindi ganun yun. Not unless kaya mo multiply sarili mo. But if you're the ones jumping from that clinic, you're just wasting your time. Hindi mo lang na ma-maximize yung time mo already. So, you just ask mo na why. Ako, the main reason kung bakit ginagawa ko to, sa lecture ko po sa buong Pilipinas, pag nagtatanong ako, sino gusto mag-treat ng bata? Wala nagtataas ng kamay. So, ibig sabihin, maraming bata in that area na hindi nagagamot. So, that's why I want to put something there. And also, I get to see my team growing, that I'm developing them to be leaders. I need to have a branch for them to be placed to be good leaders. And the cycle continues. That's my why. And pero ang susunod is when.
Yes.
When is, number one, if you have a good, clear mission and vision. Number two, if you have good systems already that is scalable. Wherein parang Jollibee, na alam mo, ang Jollibee niluto dito sa Makati is the same regular yam na matitik mo in Zamboanga because they have clear systems na replicable, na hindi kailangan na isang tao lang yung gumagawa. Kapag meron ka na yan, meron kang resource of people that you can put there in that particular branch, that's the only time. Pero pag hanggat wala ka yan, I suggest you just focus on one clinic. Focus ka muna doon. Hanggat di malinaw yung mga bagay na yan, isang buong araw na lecture yun, kulang pa nga isang buong araw eh. Pero yun lang basically. Just have to have the system that are replicable and scalable. That's the time we can do it. But it should be grounded by the reason of why yung mission.
If ikaw lang din ang gagamot dun sa ibang branches, there's no point.
Yeah.
Kung ikaw lang din. But if you can, sabi nga, replicate, meaning you can train people to do what you can do in order to reach out further, then okay. But kung ikaw lang din, Monday dito ako, Tuesday dun ako, Wednesday dun ako, Thursday dun ako, ano nangyari dun sa Tuesday to Saturday dun sa first clinic mo? Hindi sarado din. So it's basically like, you're increasing the cost, but the income is almost the same, technically. So, again, if you can replicate.
Okay. So, before we wrap up, I want to ask something more personal, Doc. Later na yung medyo mas lighter. So, one advice to your younger self. If you could talk to your younger self, the dentist who was just starting out, what would you say?
Me? Parang ang dami eh. Pero first thing, siguro I'll tell myself, na you need to understand finances when you open up a clinic. I was so in a hurry, though I finished my postgrad already. I was so in a hurry to open up my practice without actually knowing how to run a business. I thought I'm already good in dentistry. But running a business, opening up a clinic and running a business is completely different. Okay. First, imagine I opening up something that I don't know how to handle. First, there are days wherein I'll go into the clinic, clean my clinic with my staff. We'll eat lunch, sleep, wake up, eat merienda, clean again, and then go home. Because hindi naka-plan. But I opened up a nice clinic. Okay? Until I realized na, wait, I need to do something. Okay? And because I'm lecturing, nagkakaroon ng mga referrals. But again, it could have been better if I know how to run a business first before opening up a clinic. Then it would have been way different. Late ko na natutunan.
How about you, Doc?
Ba? Well, syempre, how to handle money. But if I remember it right, I super appreciate all the hardship, all the opportunities na nabigay sa akin na magkamali. Kaya parang kung babalik ako, nanahimik na lang siguro ko. Hindi ko sasabihin yung mga pwede mong magkamali, Ryan. Kaya mong magkamali ka lang ulit doon. But because I think all those hardship, all those wrong decisions has made me what I am right now. And I'm still creating those wrong decisions right now. And I truly appreciate. But
actually, we're lucky that we did the postgrad.
Yes.
We're lucky actually that I'm still into that. I mean, I strongly recommend everyone to do a postgraduate, not just undergraduate course, like dentistry period. Tapos na. The fact that we did the postgrad, we are lucky because at least 50% of the equation is done. We empowered ourselves already. But again, it's not enough. It shows that despite the fact that we are specialists, we have to go through that, okay, without knowing business. How come yung mga hindi specialista na magaling sa business, ang ganda ng patakbo ng clinic? Hindi sila specialista. Hindi masyadong empowered yung practice. The fact that they know how to, handle money, handle people, that's a businessman. And makikita mo kung gaano ka-successful yung. They may not be efficient. They may not be effective in treatment nila because they're not, ganon kagaling. But the way they run the business is really good. Yeah. So, you have to separate a professional from a businessman.
Lastly, message to the Filipino dentists. For all Filipino dentists listening right now, in their private practices, in clinics, or those who might be planning to open their own, what message would you like to leave them as they try to build better practices and better lives?
Here in the Philippines, trust the Philippines. I mean, I could have stayed abroad.
Yes.
And make things happen there. I could probably driving a Ferrari now, if ever. But I decided to go back home and do everything here. Kumbaga, to bloom where I was planted, parang ganon. Again, trust the Philippines, but again, hindi ka papasok sa gera nang hindi ka handa.
You have to be ready.
Yun lang yan, bottom line. Okay, kahit anong tapang mo, kahit gaano kakaraming baril mo, kung hindi ka marunong, hindi ka pwedeng pumasok sa gera. So you have to prepare yourself. So before you open up, you prepare yourself. You need to know what you're doing. Kasi dentistry, you know already.
Yes.
That's a 50%. The other 50% is very important.
How about you, Doc, for Filipino dentists?
For Filipino dentists, tama. Pag umalis ng Pilipinas, we can stay here.
Start the
Kailangan
love.
tayo ng mga Pilipino.
Correct.
Kailangan tayo. Well, at the end of the day, you just focus on how you can serve better your people. Your patients, your staff, your country, your community. Basta dun ka lang nakafocus sa service, malaking bagay. Pero sabi nga po, hindi lang naman po umpisa nagtatapos sa service. On what level are you going to provide that service? On how can you provide that service continuously or sustainably? Yun yung mga dapat aralin. But again, at the end of the day, ako, araw-araw, pagising ko, tatanong ako magpe-pray ako, how can I serve my people? How can I serve my patients? Help me serve my patients. Being here again, how can I serve the dentist na makikinig dito? Yun lang naman palagi. How can I serve? Because, well, we have been planted here solely just to serve people.
To give you some data, no? We have about 100 to 120 million Filipinos. And only 25% of that population can afford medical and dental services. So if you look at it, unliit. But that's about 30 million, 35 million Filipinos. For how many dentists? It's about like 30,000, 40,000 practicing dentists. So you're looking at about mga 10,000 patients per dentist. That's a lot.
Yeah. And the ratio for a good practice is only 1 is to 2,500.
Yeah, and that's 10,000 is to 1. Because the rest of the 70% ng population cannot afford. Kawawa actually yung mga nasa government practice. Kasi the ratio is 1 is to 300,000.
That's a big number.
That's a big number. They can never do that. So that would be our corporate social responsibility to help them. But again, don't be scared. A lot of my friends would say, parang
hindi na kaya.
But when we were young, my wife used to say, lipat kaya tayo, balik ka na sa Amerika. Gano'n. Parang hindi maganda na mag-practice ito. No. If you check on the numbers, we have the numbers. You just have to tap them.
Connect mo lang.
You just have to tap them. Pag na-tap mo yan at napunta sa'yo, you're good.
Yeah.
Sabi mo nga 1 is to 2,500 lang.
Dami.
Okay na eh.
Okay na yun.
Okay na yun.
Yung ratio natin, 1 is to 10,000.
That's the thing that is important. Choices. Doc Leo, Doc Ryan, thank you so much for sharing your wisdom and your heart with the Safe Space community. To every dentist and future dentist listening, we hope this episode gives you courage to look at first numbers, clarity to fix your systems, and confidence to build a practice that truly deserves or serves you and your patients. This has been Safe Space Connects, and I'm Dr. Chrissie. Don't forget to follow, subscribe, and share this episode with another dentist who needs to hear this today. Let's learn and grow together. See you on the next episode.